Medical nanotechnology, revolutionizing drug delivery. Introduction. Welcome to the world of medical nanotechnology, where the convergence of biology, medicine, and engineering has led to groundbreaking advancements in drug delivery systems. In this script, we will explore the fascinating field of medical nanotechnology, focusing on various topics that highlight the diverse applications and potential of nanoparticles in drug delivery. From targeted therapies to sustained release systems, these innovations hold immense promise for improving patient outcomes and revolutionizing healthcare. Photodynamic therapy, PDT, is a non-invasive treatment modality that utilizes photosensitive agents to generate reactive oxygen species upon exposure to light. Nano-sized particles can enhance the efficacy of PDT by encapsulating or conjugating photosensitizers. These nanoparticles can selectively accumulate at the target site, leading to efficient light activation and localized therapeutic effects. Their unique properties, such as high surface area to volume ratio and tunable surface chemistry, make them ideal candidates for enhancing the selectivity and efficiency of PDT. Theranostics aims to integrate diagnostics and therapeutics into a single platform, enabling simultaneous monitoring and treatment of diseases. Nanoparticles, with their tunable properties and versatile surface modifications, serve as excellent theranostic agents. They can carry both imaging probes and therapeutic agents, allowing real-time monitoring of treatment efficacy while delivering therapeutic payloads. By harnessing the power of multifunctional nanoparticles, precision medicine can become a reality, as personalized therapies can be tailored with optimal therapeutic outcomes. Sustained drug delivery systems play a crucial role in maintaining therapeutic drug concentrations within the desired range for an extended period. Nanoparticles offer unique advantages in this context, owing to their ability to encapsulate drugs and control their release kinetics. By modifying the nanoparticle properties, such as size, surface charge, and composition, drug release can be tailored to match specific therapeutic requirements. These sustained drug delivery systems improve patient compliance, reduce dosing frequency, and minimize potential side effects. Stimuli-responsive nanoparticles have gained significant attention in recent years due to their ability to release drugs in response to specific cues, such as pH, temperature, enzymes, or light. By incorporating stimuli-responsive components into their design, nanoparticles can overcome biological barriers, precisely target diseased tissues, and enhance drug bioavailability. This targeted drug delivery approach minimizes systemic side effects and improves therapeutic efficacy, bringing us one step closer to achieving personalized medicine. The human body possesses various biological barriers, such as the blood-brain barrier, the gastrointestinal tract, and the skin, which limit the efficient delivery of therapeutic agents. Nanoparticles have emerged as valuable tools for overcoming these barriers. Through their small size, surface modifications, and functionalization, nanoparticles can enhance drug transport across these physiological hurdles, ensuring effective delivery to the intended site of action. Such breakthroughs hold great promise in the treatment of central nervous system disorders, gastrointestinal diseases, and dermal conditions. Localized drug delivery is highly desirable for treating conditions that require site-specific therapy, such as tumors or chronic wounds. Nanostructured biomaterials provide an innovative approach to achieve localized drug delivery. These biomaterials, such as hydrogels, nanoparticles, and nanofibers, can be precisely engineered to encapsulate drugs and release them in a controlled manner at the target site. By tailoring the chemical and physical properties of these biomaterials, we can maximize therapeutic efficacy and minimize off-target effects. Cardiovascular diseases remain a leading cause of mortality worldwide. Targeted drug delivery to the cardiovascular system holds immense potential for improving treatment outcomes. Nanoparticles offer unique opportunities in this regard, as they can be functionalized with ligands that specifically recognize disease-related biomarkers on the endothelial surfaces. This targeted approach allows precise drug delivery to cardiovascular tissues, minimizing systemic toxicity and maximizing therapeutic efficacy. Intracellular drug delivery is a significant challenge due to the complexity of cellular membranes and various efflux mechanisms. Nanoparticles, with their ability to encapsulate drugs and overcome biological barriers, offer a promising solution. These nanoparticles can be tailored to efficiently penetrate cells and deliver therapeutic agents to specific intracellular compartments. By optimizing nanoparticle design, cellular uptake mechanisms, and drug release kinetics, intracellular drug delivery can be greatly enhanced. Nanoemulsions are colloidal systems composed of oil droplets dispersed in water. Due to their small droplet size, nanoemulsions provide increased stability and improved drug solubility, making them attractive carriers for both hydrophobic and hydrophilic drugs. Additionally, their unique formulation allows for various administration routes, including oral, parenteral, and topical. The versatility and enhanced bioavailability of nanoemulsions offer new opportunities for optimizing drug delivery and improving patient outcomes. Traditional ocular drug delivery methods face numerous challenges, such as low bioavailability and rapid clearance. Nanoparticles offer a promising alternative, as they can effectively deliver therapeutics to target tissues within the eye. The small size and surface modifications of nanoparticles enable improved corneal penetration and prolonged drug release. Moreover, nanoparticles can be tailored to administer drugs to specific ocular compartments, addressing various ocular conditions, including glaucoma, age-related macular degeneration, and dry eye syndrome. Surface engineering plays a critical role in tailoring nanoparticle properties for specific drug delivery applications. Various advanced techniques, including bioconjugation, surface functionalization, and layer-by-layer assembly, allow precise control over nanoparticle characteristics, such as stability, targeting ability, and drug loading capacity. By leveraging these surface engineering techniques, researchers can optimize the interaction between nanoparticles and biological systems, leading to enhanced therapeutic outcomes and reduced side effects. Chronic diseases pose a significant burden on healthcare systems globally. Nanoparticles present a promising avenue for improved drug delivery in managing chronic conditions. By encapsulating or conjugating drugs, nanoparticles can provide sustained release, targeted delivery, and enhanced efficacy for chronic disease treatments. Furthermore, the multifunctionality of nanoparticles allows for combination therapies, addressing multiple disease aspects simultaneously. These nanoparticle-based drug delivery systems pave the way for more effective management of chronic diseases. In conclusion, medical nanotechnology has emerged as a powerful tool for revolutionizing drug delivery. With their unique properties, nanoparticles have the potential to improve therapeutic outcomes by enabling targeted therapies, sustained drug release, and enhanced bioavailability. Through their diverse applications in photodynamic therapy, theranostics, and nanoemulsion-based drug carriers, among others, nanoparticles hold great promise in addressing various medical challenges. Continued research and development in this field will undoubtedly shape the future of healthcare, ushering in an era of personalized medicine and improved patient care.